Good afternoon. I am Max Aebi. I'm the coordinating editor of the eccElearning Spine Surgery Programme. It is my pleasure to introduce to you Professor Hayati Aygün. Along with an international team of experts, he has created and edited the Endoscopic Spine Surgery Education Programme for the eccElearning platform. We will talk about the program in detail in a moment, but first, maybe Professor Aygün, can you tell me more about yourself? Just, yes, what are you doing and what is your main work and so on?
First of all, I would like to thank you and your team for support and the contribution for endoscopic module during this time. I'm spine surgeon in Medicana Bursa Hospital and the Medicana Health Group. I'm also faculty member of Yeni Yüzyıl University, in English, the New Century University, Department of Orthopaedic and Traumatology. I am also chairman of Turkish Unilateral Biportal Endoscopy Society.
What is your current role and how did you become a spine surgeon? What is your practice, if you want?
Yes, how did I become a spine surgeon? If you're okay, I will start with this question. I'm spine surgeon since 2002. First, I was started to hand surgery in Atatürk University Orthopedic Department. I performed many surgeries for finger reimplantation and many finger anomalies during the beginning of residency time. After 1 year, I met with spine surgery because of my chief. He called me to help to him for a deformity surgery. When I saw the surgery, I was thinking that it is my job. I could shift to spine surgery because spine surgery was very attractive at that time. Every day, new developments and new techniques were developed in this field. Then I started to follow the spine surgeries besides hand surgery. After a couple of months, I talked to my chief about the shifting the spine surgery, and I decided to be spine surgeon. Now I'm a chief of Medicana Hospital Spine Clinic, and also I'm the faculty member of the university in Istanbul.
Okay, so that's quite an interesting development of your career. Very interesting. As you probably know, Steffi, the famous spine surgeon in the United States, he was for many years first a hand surgeon before he went into spine surgery. At which point your career did you decide to focus on endoscopic spine surgery?
Yeah, we have been performing many microsurgical and traditional minimal invasive surgeries besides the open traditional surgeries. But timely, we encountered many surgery-dependent complications like chronic muscular pain and adjacent segment pathology. Besides this, the patient must stay many days in hospital after surgeries. Wound care for big incisions were another issue, especially for elderly patients. If you want to perform multi-level surgeries, the patient must put up with severe restrictions and pain. Because of all those, many patients refused the surgery. After popularizing the minimal invasive techniques, this group has benefited from the minimal invasive surgeries, but timely we see that minimal invasive surgery is good approach, but in multi-level and the adjacent segments, the surgery was turning into the open surgery. Because of all those reasons, we start to interest to the endoscopic techniques.
Yes, I think this is, of course, something which all the spine surgeons who have long enough in this field realize that we are not really satisfied, with the the kind of surgery in many patients, specifically in elderly patients who are polymorbid patients and have a lot of medical problems. When you started or you decided to do this endoscopic spine surgery, did you have a senior surgeon who guided you, or were you more an autodidact, or how did you do that?
Yeah, first I met with it in 2004. There was a course for uniportal transforaminal endoscopy in Ankara. After seeing the endoscopy, I was saying that it will be main surgical approach for the disc pathologies in the future. Then I have been in Japan for 3 months and I started to endoscopic discectomy, but there were many difficulties because of insufficient equipment. Also, still the results were not so acceptable for me. I was performing to many revisions after endoscopic disc surgeries. So I was feeling that I need education and more practices, but find to appropriate places for spine endoscopy education was not easy. But unfortunately, this difficulty is still valid at the present time. Then I went to Germany, Heidelberg. We worked on the cadavers for more practices. This visit was affecting my results. Timely, I started to perform the interlaminar endoscopic surgery, but there were many limitations in the interlaminar and transforaminal endoscopic techniques at that time. In 2014, I started to tubular microendoscopic surgery. I had been performing both of techniques at that time. After then, I saw the UBE technique, which was promises more solution for many insufficiencies. To learn the UBE technique, I visited my master Dr. Song. First time, I was be there for learning the basic. After then, I invited my master to our clinic. We performed many surgeries together. I always started a new technique under my mentor supervision. I feel better and safe when I perform the first time with the mentor supervision.
Yeah. This is a very good description about a learning process, what you did. And I think this should be like a model for those younger colleagues who decide to go into endoscopic spine surgery. You know, you made them now a little bit easier because you created a program where basically the theoretical base is summarized in a good program, and they don't need to go everywhere to get a little bit something here and a little bit get something here. Of course, what at the end, all them who have done this program, they need is practice. They have to work on the side of a master or of a teacher so they can apply the practical work. Did you practice regular spine surgery before starting endoscopy? And for how many years do you now practice endoscopic spine surgery?
I'm very busy surgeon. I'm performing approximately 10 surgeries per week. Before endoscopy, I was performing instrumented surgeries almost every day, like you. I have about 1,000 MIS stabilizations, microsurgery, and scoliosis surgeries. After endoscopy, day by day, my technique has been shifted to endoscopy side. Today, I have endoscopic surgery every day. Endoscopy covered almost all minimal invasive procedures. All stabilizations have been performing endoscopically. Of course, I also performing the scoliosis surgeries and tumor besides deformity surgery, but endoscopy is occupied more than 80% of my surgeries.
When you look back now today, what do you think you would have liked to do or to learn to make your career a little bit shorter, because you have spent many years to be at the point where you are today?
I wish I didn't have keep my own schedule for a lot of things. I wish I didn't have to spend so much time learning endoscopic surgery. However, I consider myself lucky because at least I had the chance to receive training from the right mentors. But I wish, yes, I wish I didn't have to keep my own schedules for the lot of things. Yes,
Yes.
because I spend many times for the learning the endoscopy from the different the places, different countries. It was very difficult for me.
But I think the essence of your answer is that you learned from masters. You know, you were
Yes.
guided by masters.
Yes.
You need to work and understand first what you do with this surgery. Is that also your opinion?
Yeah, because of this, maybe we are seeing many complicated cases. Many also, I will mention about this. The many of surgeons given up because of this, because of some simple complications. So it is very important to learn the correct the searches, the new techniques.
What was the reason for putting together the spine endoscopy module for eccElearning? What was for you the incentive to do that?
I'm someone who constantly tries to match his knowledge with the literature. That's why I met eccElearning. I heard something about eccElearning at another conference. Later, when I researched, I saw that there was a very good teaching staff and that there were even very important surgeons on the eccElearning staff that I wanted to meet and learn from. But I could not easily find the opportunity to do so. In other words, I saw the eccElearning platform as a reliable and a very comprehensive research where I could improve my knowledge. Moreover, I would not be dependent on time and place. When I finally enrolled in and completed the eccElearning program, I saw how serious gaps I had filled in my professional life. There is nothing more natural than my belief that endoscopic spine surgery, which is difficult and time consuming to learn, and which I think I do best, can be taught in the most accurate way because of eccElearning program. When Sir Max Aebi suggested this idea, I accepted it without hesitation, because I believe that we can teach it without any time dependent or place dependent to the student surgeons.
Yes, that's a very important comment you made, and I think people have to think about that when they start to really learn something.
Yeah.
Did your own experience in learning endoscopic spine surgery motivate you to think more systematically on how best to train future endoscopic spine surgeons? I mean, you need a certain system in your head for the indications and the techniques before you really go with your hands, you know. Is that something what was for you also a motivation to do such a program?
Yeah, definitely yes. As I said before, eccElearning is a huge opportunity for refreshing the knowledge for me. Achieving good results in endoscopic spine surgery depends on many factors. In fact, due to nature of spine surgery, it is necessary to have sufficient basic and biomechanical knowledge in order to obtain good results. In addition to academic knowledge, receiving the face-to-face training from the right trainers and performing the applications under their guidance can be the keys to accurate and fast learning. eccElearning is a program that has all these keys.
How do you, or did you involve the other faculty members? These were your teachers, or you worked with them together, or you had the same interest? How did you extend your faculty?
I know all the developers, and because I'm following the all developments in endoscopic field, so of course, most of them was developers of the endoscopic techniques. So those who took part in the creation of endoscopic module are important surgeons who play a pioneering role in endoscopic spine surgery. Each of them has their own developed surgical techniques and have extensive experience. And also, I noticed that when I offer this to them, I feel that they also were feeling same things with me. They want to teach the surgeons their techniques, but they was in some troubles. Because of this, they accepted easily.
Looking at the program, can you briefly summarize what does the program cover, the endoscopic spine surgery program? What areas are you covering, and are you planning in the future, if necessary, to expand the program by other lectures?
The endoscopic module provides a basic and detailed overview of 3 main techniques that are actively and widely applied today. We choose those subjects because full endoscopy, unilateral biportal endoscopy, and tubular microendoscopy techniques have been applying widely. And I believe that if there are new developments in this field, the 3 techniques will be a base for them. The students who successfully complete the module will be ready for practices even in new developments. So I believe that we have to keep the program active. So we have to upgrade every year, maybe every month. So we will expand this model timely, because in this field, in endoscopic field, the development is very fast. If you keep this program in a stable, I think we will miss many developments in this field. So, but we promise the new students with the upgraded and also the current the endoscopic module and the teaching program.
I am right when I assume that this program, which is basically the theoretical base of endoscopic spine surgery, is just a part for those who want to start endoscopic surgery.
Yeah.
So they have to do, before they really go with their hands and do the thing, they have to really understand what they are doing, yes, when they are doing, the indications. I mean, surgery, you know, like everybody, the key of successful surgery is the indication, but also the knowledge, what you do, you know. So I think you agree that this is important, the program, for younger colleagues or for those colleagues who want to start endoscopic spine surgery.
Yes, completely right.
How does the spine endoscopy program help surgeons start spine endoscopy?
Yes, many experienced surgeons are trying to begin spinal endoscopy. However, unfortunately, a large number of them give up after a couple of trying, because trying to learn a very sophisticated technique such as spinal endoscopy by watching videos is not an acceptable approach, because it is very easy for complications to arise in spine surgery when the surgeon is not ready for new technique. And these complications can lead to serious consequences. In endoscopic surgery, it is very important that the technique is applied correctly. Even millimetric deviations in portal locations can affect the surgical results. Endoscopic model teaches the surgeon how to apply techniques in a certain systematic and disciplined manner. Thus, it increases the courage and confidence of surgeons for endoscopic spine surgery.
If a surgeon is already experienced in spine endoscopy, you think that this program can help him anyway, specifically when he or she is running an educational or a training program for younger colleagues? That means they have fellows or residents. You think also the teachers, they should study this program so they can help to guide the younger colleagues to really acquire the basic knowledge?
Yes, in addition to basic techniques, cervical and thoracic endoscopic surgery techniques, which are very the high level surgeries, are included in the module and operating room courses. Moreover, not only one technique, but all three techniques in current applications are given in detail. In other words, when a surgeon who is experienced in the technique, in one technique, wants to learn and apply a second technique when needed, the eccElearning endoscopic module will respond to this.
You think it should be mandatory to first acquire basic theoretical knowledge of endoscopic spine surgery and frequent pathologies accessible to endoscopic spine surgery, and preferentially online, because then you can learn whenever you want and where you are, before students really go into practical work, you know?
Yeah, I definitely think so. Endoscopic surgery of the spine provides great advantages for the patient. However, applying the same approach and technique for every pathology may sometimes cause serious complications and failures. Therefore, teaching basic knowledge at an adequate level will prevent the surgeon from encountering many negative situations at the very beginning of the journey. On the other hand, providing theoretical training in advance will make the student surgeon more ready for practices. This will significantly shorten the learning time. So it's very important to gain the enough basic the knowledge before the endoscopic surgery.
Yes. So I think we agree here completely. You know, I think I support your idea and opinion. That's the reason why I really also wanted you to create this program. You know, are there techniques in traditional spine surgery that would help surgeons in the transfer to spine endoscopy?
Okay, so of course there is. After learning the basic and the theoretical knowledge, practices such as dummy studies, cadaveric courses, and observation in the operating room may be necessary to adapt the endoscopic anatomy and gain manual skills. In the eccElearning endoscopic module, all these stages will be presented to students who want them in a planned manner.
I probably know your answer, but I ask you anyway. What do you think is the future of spine endoscopy, and what developments in spine endoscopy do you think we can expect in the next 5 to 10 years?
Yeah, I think that the gold standards in the treatment of many pathologies in spine surgery will change in the near future, and endoscopic spine surgery may replace many important techniques such as microsurgery. In the next phase, there will be phases where technology will be used more, and endoscopy will be integrated with the instantaneous radiological imaging technology and the navigation system. I believe that.
Do you think that endoscopic spine surgery will replace a certain segment of conventional spine surgery? When yes, which one? I mean, you already alluded to it, but let's formulate it clearly. There may be in a few years, for certain indications, the gold standard may be endoscopic spine surgery. So I think if you could name them, we discussed that also before. It's the elderly patient group, and we know that the people older than 80 years will increase by 400% in the next 25 years. So that is the field where we are moving into. So maybe you can comment about that.
Yeah. Yeah, as I said before, endoscopic spine surgery will replace many surgical techniques used for microsurgery and segmental stabilization. For example, the UBE technique and interlaminar endoscopic techniques can easily replace the microsurgery. In addition, endoscopic stabilization techniques have now easily become an alternative to techniques such as transforaminal lumbar interbody fusion, posterior lumbar interbody fusion, direct lateral interbody fusion, etc. If you ask when, I think it will be very soon. For example, in my daily practice, I use UBE and the full endoscopic techniques instead of microsurgery. Apart from serious deformities and instabilities, I also apply endoscopic stabilization techniques for many pathologies. What will determine the duration here is that the number of surgeons who will perform endoscopic surgery reaches a certain level. When we have enough endoscopic surgeons, of course, maybe we will replace many the traditional surgeries with endoscopic techniques.
So the air may become thin for the regular spine surgeons. You're absolutely right. You know?
Yes.
Fortunately, I'm already so old, so it's not a problem for me. You know. Yes. So this also leads to the question, obviously. So you think that in the training, when you know, let's say somebody has finished medical school and he or she goes into orthopedic surgery or in neurosurgery, and then they come to the conclusion they want to specialize. Can you imagine that then they go and specialize directly into endoscopic spine surgery without going through all these other things, what we do today? That means you could become even an endoscopic spine specialist. Like, you know, you can be, for instance, a deformity surgeon in spine surgery. You do just deformities. And so you could imagine that if somebody decides to do endoscopic spine surgery, that's what he or she is going to be trained in, and that's what they are going to practice. Or do you still think that everybody has to go through the regular thing, what we do today? You do either neurosurgery or orthopedic surgery, and then you specialize in endoscopic surgery.
Completely right. In fact, the spine surgeon can be learned at every stage. However, I would also like to point out that endoscopic adaptation is easier for young surgeons. Therefore, it may be important to start endoscopic surgery during the fellowship and the residency period. But of course, maybe even you can do the endoscopic surgery after eccElearning endoscopic model.
Yes, well, maybe we'll try. You know, we discussed that many times. That we said that, you know, to acquire theoretical knowledge is one thing, but of course you need to practice and things like that. So what role will structural spine endoscopy courses and training play in the future? That means, you know, should we offer in the training program, yes, the course, the online course with all the structured standardized knowledge, but should we combine it, as you did in Bursa, with a practical course and with tutorials which are case-based?
Yes. Yeah, the structural spine endoscopy courses can play an important role in the training of endoscopist spine surgeons. In fact, as instant transmission of surgical live video becomes easier in endoscopic surgery, it even becomes possible to perform the surgery under the guidance of the surgeon's mentor. The fact that courses are online and even face-to-face training can be online and are not dependent on time and place will now make such courses the most important learning programs for the surgeons. After enough knowledge or after basic the training, also if the surgeon wants to see more, we will invite to them to the Bursa in our hospital, and we will show them the live surgeries, or sometimes even in some the cadaveric courses, and also case-based discussions online or face-to-face discussions will be on this program in the future, of course.
Yes, you showed very impressively how this whole thing is, linked together, the training of the theoretical knowledge, the practical knowledge. I think we are at a very exciting point in the whole spine surgery perception, because, I started spine surgery officially in 1982. And when we started in 1982, we were very similar in a situation like today endoscopic surgery. Everybody said, this is not possible. You cannot do this complicated surgery. When I did the first deformity surgery in aging patient, they said, you're crazy. You cannot do that. And we were having the same obstacles as you have today. Now you come with a complete new concept. What is not so new? I mean, it's already 20 years old, but still, you have to convince people that this surgery is maybe more adapted to the kind of pathology what we treat specifically in elderly people. So I think we are at a very interesting stage today to start this training and to make it more popular in the whole spinal community.
Yes.
As you can see, now is an exciting time to learn the theory of endoscopic spine surgery so you can add it to your practice. The eccElearning Endoscopic Spine Surgery Programme is accessible to surgeons worldwide to learn the theory of spine endoscopy. To find out more about the program, please visit the course information and registration page at eccelearning.com.